it's a quite nicely moving field where we actually have already approved agents that was just lately brought in, Ropeginterferon for patients with high risk or low risk polycythemia vera. That is also now entered a clinical trial called ECLIPSE that is going to evaluate the currently established and approved administration, which is at the beginning escalation by 50 micrograms every other week under the skin until we reach the target dose of 500. However, because it's a slower escalation, we found out that maybe some patients that have a lot of disease to start with might suffer consequences of uncontrolled disease by the time we reach the controlled dose. So the other arm that we'll be comparing it is faster escalation using something we call the 3-step. So we'll go 250 micrograms, 350 micrograms, and 500 micrograms every other week, so we reach the target dose faster. So that is very exciting to learn and see what we can gain from it and how we're gonna better customize the delivery. That is a very promising agent that actually is now even moving in ET and prefibrotic myelofibrosis. So lots of excitement about Ropeginterferon. We've had 2 studies actually at this conference to show. And then we have a very, very, very important and physiologically smart hepcidin mimetic, which is an iron metabolism regulator drug that is actually seem like very interesting alternative to phlebotomies or add-on therapies to other patients that are on anything that we need to control phlebotomy needs. That was actually investigated in the phase 2 REVIVE study that was added to any therapy patients were on if they required phlebotomy. And then the Rusfertide showed to be extremely effective in eliminating the needs of phlebotomies that was achieved in 83% of these patients during the initial 28 weeks treatment interval. So that is another very interesting agent that is currently enrolling in phase 3 clinical trials and is going to show us, hey, what would be the best place to get this agent in the treatment field. So that is another very, very interesting area of a different drugs. We have very well established Ruxolitinib or Jakafi in a second-line setting in these patients. Very exciting data came from Claire Harrison that actually were called a MAJIC-PV, which was another study that evaluated the effect of Ruxolitinib on patients with PV, specifically like thrombotic events, progression to myelofibrosis, event-free survivals, and clearly show superiority. So that was a very interesting findings lately that we can actually be assured, yes, this agent also does a lot for control of the disease, including vascular complications. So there are currently studies that are placing this agent in a frontline setting as well. So we will learn better how to better sequence them because look like we will have a competing field.